Welcome to our little show, I guess. I think it's going to be us weekly. I'm Dr. Jason Fan, this is Dr. Payam Zand, and we're here weekly to talk about health tips, wellness tips, and kind of dissecting what health looks like in 2020. So we're going to be on weekly, ask your questions, we're here to answer them, but we're going to dive into a little bit of topics surrounding health and I think biohacking today. Pine, what's all the newest trends, even explained, talked about anti-aging, and they talked about metformin, and there's a lot of debate around metformin. What is metformin and how is it a new drug for anti-aging?
So metformin is a pharmaceutical that's used in type 2 diabetes. It is an insulin sensitizing drug, which essentially means that all the insulin that we produce from our pancreas to absorb sugar into our cells, all of them require receptors to respond to that insulin binding. This drug helps to increase the sensitivity of those receptors to the insulin coming in so that our cells can absorb the sugar with less insulin response. So when we optimize our blood sugar, essentially this is where the anti-aging aspect of it comes, our overall health increases. Why is that? Because elevated levels of sugar in the system, higher than we need, become extremely inflammatory. They make more reactive oxygen species, they make more oxidative stress, the blood becomes a little bit more viscous or thick, and we get impaired blood flow, we have more inflammation throughout the system. It is a precursor for atherosclerosis or hardening of the arteries, so it affects our cardiovascular health. So it's highly inflammatory, and so being able to manage that insulin response can be quite effective from a biohacking perspective or a health perspective. But a lot of the foundations really need to come from the diet, need to come from exercise, and there's a lot of other supplementation that we can do to sensitize insulin, to decrease that blood sugar response, and kind of improve our overall health and decrease that inflammation level.
From the research, is usually for diabetic patients that are not overall super healthy, so their metabolic system's impaired, so it increases the life expectancy for people that have metabolic syndrome or metabolic disease. So now, moving into it, for the biohacking perspective, mainly people are going to be super athletic, diets on point, insulin receptors are working properly, glucose is or not elevated and pretty adequate. So those patients, actually metformin is a mitochondrial toxin. Mitochondria is a powerhouse to the cell. So as athletes use anaerobic and aerobic exercise, they're going to build lactic acid in the body, but they're actually going to improve their mitochondrial health with exercise. So it's actually, I believe, counterproductive to use metformin in the biohacking perspective if it is a mitochondrial toxin, because as you increase your mitochondria through exercise and all the other biohacking tools, cryotherapy and light therapies and whatnot, you're actually killing off some of your mitochondria with the toxin, with metformin. So conflicting research. I wouldn't take metformin just yet, but if you do have type 2 diabetes, it can definitely help.
Yeah, certainly. For type 2 diabetes, it's a good drug. For the biohacking perspective, there's other things that you could do, from botanicals to anti-inflammatories to nutrients, that could achieve the same effect without having all the side effects or negative effects that come alongside it.
Yeah, for sure. I think we'll dive into next just hormones. What are hormones? What's hormone replacement therapy, and how can hormones really affect our quality of life?
Yeah, certainly. So hormones are going to be a huge part of our health overall. So this is going to dictate everything from quality of sleep to your drive to libido to muscle recovery to hydration of your skin and eyes, hair, nails. It plays an enormous role throughout our systems. And as we age, these hormones tend to decline. So after our early 30s, everything starts to kind of drop off a little bit. Yeah, right.
So what do I do?
There's a lot of things that can be done from a more subtle perspective to a more invasive perspective to try to rehab these hormones to optimize them a little bit more. So from the more subtle side, there are botanicals and nutrients that we can utilize and amino acids that are going to be precursors to a lot of these hormones that we can slowly start to just nudge things in the right direction to keep things optimal. Once it's a little bit more far gone and we run labs, we see that the hormones have really dropped off, we can always add in external hormonal therapies to aid in balancing things out. So what is that going to look like? You can start off early in the hormone chain with hormones like pregnenolone and DHEA, or you can start downstream with things like estrogen therapies, testosterone therapies, progesterone therapies. So everybody has a little bit different perspective as to what is the right choice there. And every patient is going to be a little bit different on where in that pathway we might want to intervene or interject and start to change and move things a little bit. But, for the most part, the basic philosophy is trying to start it at the least invasive or most subtle place we can and try to go from there.
I believe hormones play a tremendous role within health. I'll start with women. Women's hormones fluctuate once they start puberty. They start getting their menses, they start getting acne, things start fluctuating through the body super rapid. But it happens every month. Told my business partner, Allie, I guarantee clumsiness from a female is usually due to hormones. I don't know which one, but they're always clumsy around a specific time. And that one's interesting. It's if their motor function decreases with a rise in estrogen or a decrease in estrogen. I don't know what it really is, but that's why they get mood swings, cramping, all the symptoms that they usually get towards their cycle. So balancing those over time is going to be super important. But balancing inflammation is going to be the most important. Digestive health, making sure inflammation is down. But for males are a little bit easier. You need to have enough testosterone to have executive function. You got to have drive, your libido, your sex drive, your sleep function, your muscle mass, the things that are important to males. And in younger males, I think they achieve higher testosterone levels with eating a clean diet, sleep, and making sure they're digesting their foods well, like decreasing their cortisol and cholesterol, cortisol, and their inflammation markers. But then if, let's just say your late 20s, 30s, 40s, 50s, almost like just microdose, endogenous or exogenous. You can stimulate the body with secretagogues to actually increase hormone levels of the precursors that you're talking about, like pregnenolone, DHEA. Or you can microdose, exogenous hormones. For instance, if you microdose growth hormone, if you microdose testosterone, those are some subtle ways not to shut off natural production of testosterone. And then you got to mitigate where do these things funnel into, because it's a pathway. It can funnel into DHT and cause hair loss or prostate issues, or it can funnel into more estrogens, which cause gynecomastia or man boobs. So it gets quite complex into what it is, because it's a whole functioning system. As you increase one thing decreases. As you decrease one thing increases, and it has side effects. And that's where pharmaceuticals come in to really change the game, because it will block one whole receptor, and then everything else scatters between the chemistry for it. So
and I think this is the importance of regularly checking lab work, especially when you're first starting to do any kind of hormone replacement or any kind of precursors added into the system. You want to make sure that every 3 months there's some kind of hormonal check going on and looking at the entire hormone cascade, so that if you're converting in one direction or another, because everybody is a little bit different in some of these pathways and how they preferentially convert in one direction or another, how can we mitigate it? How can we control it? How can we optimize it so that we're really getting the particular hormones we want and we're not overdoing one or another?
Yeah, for sure. And yeah, hormone health is quite complex. There's a lot of different strategies, but I think just finding the right doctor that fits your specific needs is important. But it might not be a hormonal issue. It might be, you know, an inflammation or a glucose dysregulation that we just need to correct. So
certainly. So anytime the inflammation levels increase, a lot of our hormonal levels start to drop off because it becomes a lower priority for the system. So a lot of times hormonal dysfunction is tied to some sort of an inflammatory reaction in the system. And once we correct that balance, hormones start to come back online.
Yeah. I think we'll end it with, or in 2020, everyone's got their health and wellness goals. How do you keep patients focused in on just their health goals? Everyone knows, I want to lose 20 pounds. Like, they know not to eat the ice cream, the cookies, the cake, and, you know, indulge on a bunch of sugar. They know it, right? There's a bunch of diets out there, intermittent fasting, but what's preventing people from reaching those specific goals? Or, hey, I want to go to the gym 5 days a week. I'm going to get a fit membership and, you know, go 5 times a week. And then later on in the weeks that pass, maybe they're going once or twice or maybe none at all. How do people stay consistent and committed?
That's going to be a tough one. You know, everybody's going to be a little bit different in what motivates them. Having someone there to hold you accountable, whether it's a partner or your physician or a friend, parents, whatever it is, I think that's an important influencing factor to be able to say, okay, there's somebody that is checking to see how I'm doing. There's somebody that's going to be helping me to accomplish my goals. From our perspective and what we can do to help patients in achieving their goals is give them the tools as far as dietary recommendations, hydration recommendations, sleep recommendations, supplement recommendations to optimize whatever it is that they are struggling with in particular, or that can kind of get them to that next level. And once they see some tangible change or shift, that in itself is a motivating factor. But I think you touched on a really important part, which is the psychological part of the self, which is why, right?
Why do we want the goal? Like, why do you want to lose 15 pounds? It's always so important to tackle why do you want it? Because it's not losing the 15 pounds because you're going to go on the scale and be like, I lost 15 pounds, whoop, whoop. But it's, hey, when I look in that mirror, am I actually feeling good and looking good in my own body? Or am I getting an acknowledgement from my boyfriend or girlfriend or husband and wife that really I'm taking care of my physical body and I feel good? Maybe that's your why. Or just like, hey, I want to lift this 1,000 pounds off the ground and be, you know, a bodybuilder or whatever it is. Like, what is the why that's going to push you each and every day to get it? It happens to business, it happens with your physical body, it happens with your health. For instance, if a patient just got diagnosed with cancer, what do? Are they in a fear mindset and like, oh, I'm gonna listen to anything? Or do they actually take it and actually sit back and say, all right, why? How do I understand the strategies and concepts for it? And let me go get it. You know, is it, you know, long-term fasting, you know, going ketogenic? Is it natural therapies? Is it, you know, chemotherapy and radiation? I think they're all right answers. But like, where's the why? Like, why are you doing it, right? Unless you're pushed against the corner, are you really going to do it? Like, what if you're not pushed against the corner? Who are you to actually go through, push yourself against the corner, get uncomfortable, and get what you want? So I think that's massively important in 2020, because we don't have the plague, we don't have influenza killing us, we don't have mass war right now. Like, everybody's in a good space. So we're living in the best time because we're living in the present. So what do you want to do in life? And that's up to the individual person. But yeah, the philosophical stoic Jason coming out. Anything else anybody wants to know? Ashton? Nothing. Rachel? Nothing. I think we'll end it here. Thanks for joining us. I think hopefully you guys got some good tips. Any questions you guys want to answer or want to ask for us to answer, Dr. Zan's going to be the very microscopic nutrients and education of health and wellness in the biochemistry. And hopefully I make it light and fun and give you guys some concepts in layman's terms to really impact and change your life. So see you next week.